Good afternoon, everyone. Myself, Madhu Kushwaha, Assistant Professor in SIRT Pharmacy, Bhopal. The subject name is Pharmacology Second, BP 503T, Unit 3rd. The topic name is thromboxanes. Today we will discuss about thromboxanes. Thromboxanes, a substance made by platelet that causes blood clotting and constriction of blood vessels. It also encourages platelet aggregation. There are two thromboxanes. Thromboxanes A2, also called TXA2, is active but is very unstable and has a half-life of only 30 seconds before it undergo hydrolysis to form thromboxane B2, which is inactive. The thromboxane are derived from arachidonic acid, promote vasoconstriction, bronchoconstriction, and clot formation. This is the chemical structure of the thromboxane. Thromboxane are substance made by platelet that causes blood clotting and also encourage platelet aggregation. Aspirin acts by inhibiting the COX enzymes from synthesizing precursors of thromboxanes in platelet, thereby reducing platelet aggregation. Thromboxane A2 stimulates blood platelet aggregation, essential to the role of platelet in blood clotting. Many people take a daily aspirin for its anticoagulant effect attributed to inhibition of thromboxane formation in blood platelets. This if Second, this effect of aspirin is long-lived because platelets lack a nucleus and do not make new enzymes. Pathophysiology. The pathophysiology of thromboxane A2 includes increased production in the setting of injury and inflammation. Increased production leads to increased activation of the TP, which increased platelet activation, aggregation, and vasoconstriction. This all result in thrombosis and thus decreased blood flow to various parts of the body. Furthermore, pathological state can disturb the physiological redox state of cells, leading to increased ROS exposure of these ROS to membrane lipids can induce non-enzymatic peroxidation reactions leading to the production of isopros, isoprostanes, which also activate the TP and increase rate of thrombosis. Then function of thromboxanes. The functions of thromboxanes is are synthesized by platelets, induce platelet aggregation, promote vasoconstriction, lymphocyte proliferation, bronchoconstriction, and promote clot formation is the function of the thromboxane. This is platelet and this is the endothelial cell where COX1 and where COX1 is present in the presence of when taken in acids block COX1 and COX2. COX1 blocked by acids then not form thromboxane. Vasoconstriction promote platelet aggregation, cause hom- homeostasis and thrombosis. Then in endothelial cell, block COX1 and COX2, foster cyclin PGI2, vasodilator and inhibitor of platelet aggregation is the thromboxanes. Clinical significance. Myocardial infarction occur when there is complete occlusion of blood flow to an area of the heart. thrombus formation mediated by thromboxane A2 induced platelet aggregation and vascular constriction sometimes causes myocardial infarction as well as infarction of other organs is the myocardial infarction. Atherosclerosis. Atherosclerosis is a chronic disease of the vasculature that is influenced by multiple factors that involve a complex interplay between components of the blood and the arterial wall. Thromboxane A2 and isoprostanes as well as PGI2 are known to promote the initiation and progression of atherogenesis through control of platelet activation and leukocyte endothelial cell interaction is atherosclerosis lungs. In lungs, thromboxane A2 induced contraction of bronchial smooth muscles may contribute to asthma, which has been improved by TP antagonist, and thromboxane A2 is also involved in bronchial muscle hyperplasia and airway remodeling in asthma. Studies have also shown that pulmonary hypertension associated with ischemia reperfusion result in part from the pulmonary release of thromboxane A2. In kidney, thromboxane A2 is involved in nephritis and the nephrotic syndrome of the kidney. TP stimulation of the mesangial cell cause cell contraction, promote proliferation, change cellular ion fluxes, increase the mRNA level of the fibronectin, fibronectin, laminin, collagen, tissue plasminogen activator, TPA, plasminogen activator inhibitor first, PAI first, and accelerates transformation growth factor synthesis. Then last, allergy and inflammation. Research show that thromboxane A2 contributes to the pathogenesis of asthma, rhinitis, and the atopic dermatitis. Allergic inflammation is the fundamental pathophysiology of allergic disease and closely correlates with disease progression and ex- exacerbations. Thank you.